So let's talk about risk assessment. How do we identify patients at risk for AF? And remember that term incident means new AF, not prevalent. That's already diagnosed. Incident means new diagnosis. The 5-year risk of atrial fibrillation in the CHARGE AF model. These are the things again. When the patient walks in the door, I'm already thinking about, okay, hypertension, diabetes, myocardial infarction, age. You can see what the hazard ratios are for each one of these independent risk factors for developing atrial fibrillation. So that the gentleman mowing the lawn, I mean, all of these things are telling me that, according to this Charge AF model, that individual is going to be at high hazard or high risk of developing atrial fibrillation. If you look really even at weight, what does that mean? 15 kilograms. Let's look at that specifically. Line 4. 15 kilograms. The way you would read that hazard ratio is that for every 15 kilogram increase in weight, there is a 12% increased risk of having atrial fibrillation. So now just add on, 70 pounds. I mean, what does that mean for atrial fibrillation? And that's how you would interpret the variable with the hazard ratio. And when we look at the stroke risk, again, this has to be just committed to memory. CHA2DS2-VASc. It's so easy. Really, there's no excuse to not know how to calculate the CHA2DS2-VASc score if you're caring for adults. You need to know it. Heart failure is 1 point, hypertension is 1 point, age 75 or greater, 2 points, diabetes 1, stroke is 2. You simply add these up, and a woman with a CHA2DS2-VASc score of 3 should be offered an anticoagulant. For men, it's a CHA2DS2-VASc score of 2. Absolutely should be on an anticoagulant. If your CHA2DS2-VASc score is 1 and you're a man, or a CHA2DS2-VASc score of 2 for women, you really should be considering an anticoagulant. Again, stroke prevention in atrial fibrillation is very important. We know that the higher the CHA2DS2-VASc score, the higher the risk of stroke. So if you look at somebody with a CHA2DS2-VASc score, let's just look down there, of 3 or 4, that's a CHA2DS2-VASc score of 4 is a 3% per year risk of a devastating stroke, 1 in 30. Those odds are too high. And there are other factors that, among other patient populations, have been shown to also likely increase the risk of stroke. And I would just encourage you to look at those and have those available, because if you have a patient sort of on that cusp, that CHA2DS2-VASc 1 or CHA2DS2-VASc 2 for women, there may be some other etiologies in here, proteinuria or the size of the left atrium, that may push you to offer an anticoagulant. So that the key takeaways here, 2 models you got to be familiar with. Charge AF model predicts someone's risk of developing atrial fibrillation. So that's important, because now you're going to focus on the cigarettes, the alcohol, the weight, making sure the diabetes is well controlled, get that A1C under 7, all of these things. And the CHA2DS2-VASc score to identify patients at risk of stroke in AFib.